आता तरी मला विचारलं मी दीदीला.
झालं काय करायचं इथं रात्री
जमत नाही.
जम जसं मला आता सगळं
हा?
जम जसं
हो, कॉन्स्टिट्यूशन
कॉन्स्टिट्यूशन घेऊन जा ना सोबत
एनिमाचं हे तिथं करते एनिमा.
त्याला काय झालं करते ती
नाही तिथं अवघड
हा मग काय नाही ना
मग नाही जायचं तर काय करायचं? एनिमाचं भाडं घेऊ.
अगं नाही
मग आता नावायचं मदत करते का मी?
Hello, sir. How are you? I'm Dr. Dharmendra Gundru. Rajesh Mehta.
So let us start today's session on virtual reality. So this is a part of virtual medical education. You might wonder that the detailed write-up is virtual medical education, and into bracket it is VMC. C stands for college. Because of legality, we can't label it as virtual medical college. Essentially, it may be like that. So we call it as virtual medical education. So in this, as a part of virtual medical education, the,
તારે નહીં હોય
મારે નહીં હોય SFC નું
હા એમાં
ફાઇલ છે
people
ટીબી
people
છે
should
એમાં નથી
એમાં નહીં હોય એમાં નહીં હોય
can
તમારા
you
human
can you
health
keep yourself? Can everybody mute themselves?
હા હા તો પેલી
Please, please mute yourself. So basically, virtual medical education, the objective is so many medical colleges are opening up. All the medical colleges, all the teachers may not be competent. So to fill up that gap, we thought that if we have virtual medical college, it will be much better. The student can learn anytime they want to learn from the best teachers of the world. Now, we'll have basically the 20 departments as it exists in the medical college. But the style will be integrated way it will be taken. And also the explanation in depth. Also, there will be interaction with the students. Currently, we have only few people as a participant, but we said that there will be thousands of students who will be attending the various courses. Now, before we go to the virtual reality, we need to understand these three terms: virtual reality, reality, and ultimate reality. whatever we see and hear and listen, that's reality, what as we understand. In virtual reality, uh, people should people should keep muted anyway. So, in virtual reality, there is absolutely no patient, but the perception will be as if the person is working with the patient, with the person, including operation or dissection, everything, including these skill development will also be possible along with the knowledge. In reality, when we deal with the patient, usually we should be do as far as possible, first with the postmortem or the dissection on dead body, etc., then the volunteers, and then the real patients. So before this procedure, if we go for the virtual reality, much the exercise has been done with the muscles, brain, etc. And when we want to talk about ultimate reality, even what we see with our eyes may not be true in ultimate sense. So can you mute yourself? Everybody is requested to mute yourself. You will be given a chance to speak later on. Right? So, in ultimate reality, what we mean that the energy which drives us, the force within which we can't see, but that is the truth. And that reality, if you want to understand, various parameters of various exercise like meditation, etc., is to be done, and that spiritual exercise is the ultimate goal. But currently, we are limiting it to how to improve the medical education in our nation. And I'm sure that this virtual reality will be useful to not only the medical colleges, but the nursing college, the Ayurved college, homeopathy college, etc. also. And in this virtual medical college, we envisage various kinds of people for the technical leadership, administrative setup, because more than thousands of students are going to engage themselves. And we are very clear that we will adapt whatever is good for the humanity. We will not talk only about the allopathy or homeopathy. We are going to go for integration of various healthcare systems. In this training will not be limited only to the medical colleges. It will go to the rural area also. It will go to the veterinary hospital also. It will go to the training of the village folk, etc. also. And we'll have a lot of research projects, etc., intermingling with the government, corporate sector, volunteer organization, etc. Our People's Health and Development Trust is already having CSR facility. We have the Human Health Circle as a platform, and also People's Health and Development Trust to boost that platform. And we invite various speakers from across the world, because you have some of you might have seen that the first lecture was taken by USA based doctor and Dr. Shizal of India. Today's lecture is I am from Gujarat, the Dean of a medical college at Pujya Mukta Nand Bapu Medical College and Research Institute. And my colleague is from South India. And we are going to have the experts from the Ayurveda, homeopathy, legal experts, chartered accountants, environment experts, agriculture experts, together, so many other specialists. Because we are not concentrating only on the medical care, we are also concerned with the health care. And that's why we would like to have integrated approach. So now I will hand over mic to my colleague who is expert in virtual reality, and he wants to bring this accessible and affordable to our country also. Because if you think of the price of 2 CR, 3 CR, etc., hardly few people can afford. But he has come with a technology whereby only 10% of the cost of the developed country he is going to provide to the medical colleges in India. So I now invite Mr. Ashish, who is my good friend, and will talk about the virtual reality. On my request, he has agreed, and he has also prepared the book on virtual reality. Ebook is fantastic, and those who stay back with interest, they will be given this ebook free of cost, which will ignite them to have the this kind of modules at their own college. In Gujarat, at least out of all the more than 40 colleges, in our college, at least Pujya Muktan Bapu Medical College, we are thinking that will be one of the user of this technology. And the other medical college also will invite for a workshop to actually take a feel of it. So this is just a preliminary session which will tell you what the virtual reality is and how it can be utilized. Uh, Now, Mr. Assis, please take over.
Sure.
At the end, we'll have a lecture, the question answer sessions.
Definitely. Sure. Thank you. Thanks a lot, Dr. Rajesh sir. And it is a pleasure to have this conversation and share our mutual technological understanding with so many people over here. So let me just go ahead and start introducing about what we do, how is the impact being created in India specifically right now, and what do we, what else do we do in the virtual reality, right? It's not just the patient and your training on the patient. It's about pre-operative, intraoperative, post-operative, all the things where it can help the patients, help the doctors, help the students, all of them. So let me share the screen. Can you give me the permission to share the screen, please? Hello, Dr. Raj sir.
Seminar also.
1 second. Dr. Rajesh?
Yes, I'm just giving.
Yeah,
Giving.
sure. Okay, by the time sir gives me the permission, let me start introducing myself. My name is Ashish Margudri from Maharashtra, from Pune. I'm the CEO and founder of company Inyon VI Technologies. We have our office here in Pune, and we have been in this field for more than 3 years now, developing virtual reality-based and mixed reality-based medical education and training purposes for medical students, specifically catering to MBBS, PGs, and also professional doctors before they enter into a surgery. They use our simulations for understanding a specific anatomy of a patient. And so along with that.
ಕೈಯಲ್ಲಿ ಎಂಜಲ್ ಮಾಡ್ತಾರೆ ಬಾಯಲ್ಲಿ ಬಿಡಬೇಕು ನಾನು ಕೈ ತಗೊಂಡ್ಬಿಟ್ಟಿದ್ ಮಾಡ್ತಾರೆ ಬರೀದಕ್ಕತ್ತಾನೆ
Dr. Rajesh sir, are you able to give me?
I think try now.
Okay. No, host disabled participant screen sharing, it says. Okay, now I can.
Just
I can. Yeah, now I can. Now. Sure. Thank you. So, in a very short sentence, we are revolutionizing medical education and training through virtual reality and mixed reality. So we all know the current problem that is being faced by the medical institutes, colleges, every medical institute and colleges, that the current transitioning from books and videos, which has a lot of texts and written forms with just 2D images, from the textbooks and videos to the live OT has been very weak, which leads to prolonged trailing phases, increase in medical education costs. As we all know that India has one of the highest medical education costs, and less confidence in OT, and at the end leads to casualties. And the current solution that are being implemented in medical institutes are such as this 2D tables, which again gives you a 2D experience, cost about 2 CR with just for anatomical presentation, and has very, very huge setup, very limited number of, I mean, can have only one per college and only 5 students standing around it, right? So what solution do we bring? We bring a immersive AR, VR learning, virtual reality, mixed reality, augmented reality, all comes under the same domain with the dynamic interaction. So if you are cutting a patient's first layer of the skin, then you're going for a subcutaneous tissue. If anyone is a doctor over here, right? I hope you all are understanding of the terms. So as we are moving in the surgical process, you can be able to cut each and every single part of your skin, understanding each and every single anatomy of it. And a little bit of haptic feedback to it, giving a tactile feedback on your hand as you're cutting a deeper skin into it. Multi-person classroom, just like we are right now in this Zoom meet, we have a platform where multiple doctors, there's a one doctor who is a professor, a senior doctor, and there are 7, 8, 10, 20 students in the same virtual room, and the doctor is being able to perform on the virtual patient while guiding the students in the proper way on what tool to use when, and understanding the problems behind it. If the surgery is done wrong, what is the issue that has been caused, and then the doctor can be able to teach the students. Performance tracking, where the students are able to perform the complete surgery by themselves and are the tracking system, the numbers, the marks, their time and motion, how much time did they take for the surgery to complete, did they use the proper tools, did they select the proper tools before entering the surgical room, hence that can be performance track. I'll show you the video soon that we have. So this is in the layman terms, this is what we are currently focused on engaging with the medical institutes. With the 5 to 20% of the lecture reading and audio visuals with the anatomical radiological presentations using virtual reality, where the doctors or the professors are the one wearing the VR headset in front of 60-70 students of a classroom. And the other and he's able to see the students as well as he's able to see the 3D model in front of him. Another demonstration, discussion, and practice doing is basically a rigorous training, right? Hence, in the virtual reality or mixed reality, they will be able to train on a patient constantly, making errors and errors, and then learning through it. Now, our tests, what we have seen over here, we have done more than in 10 plus medical college tests. Looking at the right side graph, we have seen a research paper where the current readiness level of an initial student, medical student, during his first surgical experience is only 20%, right? That is the confidence level that we speak about. After using the virtual reality-based, simulation, understanding the complete surgical stepwise understanding the surgery simulation, the readiness level increased from 20% to 80%. And over to the left graph, we see what exactly the virtual reality will help you in. Like knowledge of instruments, what instrument that you're going to use, you're going for open surgery, or you're going for a laparoscopic, or you're going for robotic surgery. Instrument handling, how do you handle the specific instrument? If you're going for anesthesia machine and more such kind of flow of operation procedure, if you go through one.
લઈ લે ને ભાઈ અત્યારે કેમ ઉતરવાનું છે
શું ભાવ કેળા કેળા 40 ના છો આટલા મોંઘા
Please mute who is I'll be opening the session for the Q&As. Yeah, so at the graph we can see flow of operation procedure, forward planning, and completion accuracy, where each and every step you perform can be understood only if you have performed a correct step, or this is the rare case patient, do you have to go in a different way. So let's first see what exactly the hardware that is being come to the India or in the world has a difference to it. How does the current hardware used, which increases the cost, and how does our hardware has a complete different understanding to it. So we will first see the difference between PC VR and Inyon VR. So PC VR is nothing but, one second. Sorry about that. Yeah. So PC VR is nothing but a virtual reality headset used along with the PC and wires and a huge PC setup where you need one more instructor to be there with you, where there are a couple of doctors or students, medical students, who are performing for the using the virtual reality, and they have a PC VR system. Now in this hardware, I'm specifically speaking about what is the difference between the current which you need to select and which you should be very careful about, right? In PCVR, there are multiple setup, big spaces, higher budget, increase the budget 5 to 10 times more than just a VR system. Now, if you see what we bring, we have just the virtual reality headset, which costs about starting from 30,000 to 50,000 per headset cost, the hardware cost I'm speaking about, which is easy to set up, easy to wear, just wear it on your head, and you can start the simulation, you can start the training, no setup cost. You just have a table, round table, where you can just set it up, 10, 20, as much as you say so. Easy to carry in just a bag of less than 1 kgs. You can just carry it around anywhere you want to. You carry it on. So some of our clients we have seen, instead of keeping it in the simulation lab, they have taken it to the OPDs and sometimes showcasing it to the patients that this is how your surgery is going to be, just for them to have a clear understanding. Hey, you will be safe with this surgery. There is no problem to it. So yeah, no training cost. You only need one instructor, where a complete institutional module. The instructor will be able to see each and every single step that a certain student is going to do. He's able to enter into their head exactly how they're doing, and they'll guide him step by step. And obviously, we need less space completely. Now let's speak about the specific surgeries that we are doing. Right. In the initial years, we have done general surgeries such as lipoma, excision, sebaceous cyst. If anyone over here is a general surgeon, they'll be able to understand that there are different processes that we have to go for an appendectomy surgery, right? You either go with the open or you go for the laparoscopy. If you're going for the open, there are different ways that you can use either a cautery or a bipolar, and then you have to move further with it. So in this small presentation, he's able to grab each and every single tool, a virtual tool, not a live tool, and being able to cut this first layer of the skin, then the subcutaneous, and then as it goes on, all the 5 to 8 layers of the skin. Now, since here the patient is skinny, we have specifically mentioned this patient is skinny. They can be able to select a fatty patient as well, where there will be more fat tissues. And they're able to burn it with a cautery, or they're able to cut it with the scalpel or the scissors. After cutting all the layers, they are able to pin down the tinea coli and then expose the appendix. With the mesoappendix, understanding where the blood vessels pass through, and then tying or burning. You either tie it or you burn it with the bipolar, and then you exercise the complete appendix. Now, similarly, we can see over here the same procedure for laparoscopy based, where he's able to, in the laparoscopy, all you have to do is look at the screen. So we insert a camera through a trocar, and using the harmonic device and cauteries or any other tools, he's able to properly set his hand inside the trocar and grab the appendix. As looking at the hand-to-eye coordination in the laparoscopic simulations are quite important. Hence, this can give you a hand-to-eye coordination, one of the best, easiest way to train your hand-to-eye coordination in the laparoscopy. You see, since this was done by a very early stage student, it's quite difficult for him to understand where his tools are going and how exactly how to cut the mesoappendix. And that's where the hand-to-eye coordination was able to, create a difference. And going on ahead, putting in the ring and then cutting over it. Now, recently we have shifted on to a nursing or paramedical based simulations. How nursing and paramedical based simulations are currently creating a huge requirement in the medical institutes. Because at the end, they want to train their MBBS students as early as possible, as accurate as possible. So here we can see we have multiple nursing simulations, IV cannulary, blood sample collection, and many more, ECG with multiple patient cases, not just one patient case, but multiple patient cases. Each and every single step can be first. Initially, we went with a guided procedure, where the student or the healthcare professional is being guided properly on what steps to do first, then the next step, then the third step, then the fourth step. Understanding the patient's condition and then guided them properly is the very first important thing. And then after guiding them, once they have learned, after a month or so training each and every day or every week on a single specific simulation or specific surgical presentation, they are told by their instructor or the lab instructor to perform a performance analysis, which I'll be showcasing you in the next further. So this is the ECG. So in the ECG, they first pinpoint each and every single V1, V2 on their chest, a hand and their leg. And we give a small X-ray view of the chest as well, where they are able to understand where exactly to place the V1, V2s, all the points, along with the electrode color mentioning. And at the end, we can have each and every single patient's different conditions of the patient. And on that basis, if you click, you get a proper data out of it in that manner. As you can see here, sorry.
Wait, One
second. I think the net is a little bit slow. So yeah, in the ECG, they can go through a stepwise procedure, and then going on through after the ECGs, that is the performance analysis. One second, the video has been a little bit paused. One second. So I'll just start the video in the. Yeah, so this is the performance analysis where they are given the steps information, but they're not told to do which step to do first or second. And if they make a mistake, it gets crossed and they get a marks cut as well. So all of the marks that we have specifically mentioned for each and every single step. So if there is a step which needs to be specifically done, which is very important for the student to perform, we give a larger cut to the marks if they did not do that step or they do it wrong way. And if there is a smaller mistake, we cut it small. And this all mark system has been validated by many medical colleges over here with our institutional collaborations. So giving an example, if I use alcohol swab and I don't throw it properly in the dustbin, or if I use the cannulation and I don't throw it in the proper sharp waste dustbin, my marks get cut. It shows cross, and at the end, see, I did the time and motion properly in the correct form, knowledge of instrument. I selected the proper tool. If I have to perform a specific IV cannulation or a specific ECG, I have to select those tools which are necessary for the patient currently. I got 100 because I selected all the tools properly. Flow of operation, I got only 81% because I missed a couple of steps and I did wrong steps in between. And then completion accuracy is all the steps included as a taken as percentage. And you get a graphical data presentation. And the same data will be going towards directly through cloud without any use of internet. Will be going to the instructor or the professor's tablet or mobile or his laptop. If he just logins into our website, he'll be having that student's surgical data completely to him. Now moving on ahead. So as I told you, it's not just the virtual reality is not just used. Virtual reality is not just used for training. It's also used for intraoperators as well. So we have done a couple of simulations with the Krishna Medical College over here and Karad. And so we have created X-ray based 2D to 3D conversion for MRI CT scans. So what we took the DICOM that you get from the radiologist, and we put it in the live form. We put it in our headset. We created an AI algorithm, and with that DICOM, we're able to see that patient's data. So there was a small pin in the patient's back, which you can see a small pin in his back, and that DICOM which you see. So basically, these are the slides or the small images that you have, and these images are placed over one or the other, and you get a complete 3D data out of it, which helps the doctors during the diagnosis of the patient.
और अगर कॉन्ट्रैक्ट करेगा तो किससे करेगा? उसको हिप तो एडजस्ट करना होगा ना? Means hip needed to be stabilized. Are you getting the point?
Come again, please.
जब तुम बॉडी का मोशन तोड़ते हो, जैसे मैंने कमर टेढ़ी कर दी, या मैंने कमर सीधी कर दी, या मैंने पैर सीधा कर दिया, या मैंने पैर मोड़ लिया, तो जो एक टोन है वो मसल का वो टूट गया,
कंटिन्यूटी गई।
हाँ, तो उसके साथ इरेक्शन भी लूज होता है। ठीक, ये फर्स्ट थिंग।
बेसिकली प्रॉपर एडिक्वेट लेवल ऑफ कोऑपरेशन नहीं आ रहा है क्योंकि सिंक्रोनाइजेशन में नहीं चल रही है चीजें।
हाँ,
वो बिल्कुल बेचारा ठुस पड़ा हुआ है।
फिर जब तुम मुझे एडजस्ट करने के लिए पोजीशन चेंज करने के लिए बोलते हो,
तो फिर वो घपला हो जाता है,
कब लो।
लॉन्ग अवेटेड चीजें खत्म।
हाँ,
क्या मैं पूछ सकता हूँ कि स्पेसिफिक सिमुलेशन की बात कर रहे हैं अपन? आई एम नॉट एबल टू अंडरस्टैंड इट. Okay. Let me just finish it and then I'll get back to you if that was a question. And speaking about the intraoperative implementation, so we were able to, this is a neurosurgeon and he was able to take the data from his screen, a 3D data, into his VR headset, which he was seeing in the mixed reality. He was able to see the patient. This is currently a non-live patient, obviously. So he was able to see the patient as well as the screen that is specifically in the front of him. And using that, he was able to place the patient's brain MRI scan live during the surgery, which when he was able to understand where the tumor is and where he needs to incise properly. And that is how the virtual reality or mixed reality can be also taken affront in this medical field, not just for medical simulation or training purposes, but also for intraoperators as well. So yeah, actually that is it about the introduction and understanding of the virtual reality and how it helps. I would like to take the questions or any doubts. I think we just were with someone. I couldn't get the question exactly. Please.
Now session is open for question answer. Anyone can ask a question. If there is no question, let me ask question. Can we? Anyone else wants to ask a question? Narendra,
Yes, sir.
you should have some question. Yeah.
Sir, Kalpesh here.
Yeah.
I just wanted to ask Mr. Ashish that is the virtual reality utilized for anatomy and surgical cases only, or are we doing something else also, like in non-clinical subjects like healthcare management or leadership or something like that? Is it helpful in that kind of subjects?
So yes, so we specifically work into medical education, but virtual reality, mixed reality has been helpful in many other fields. Specifically, giving you an example, actually, we are currently working with a medical training system of the Navy in Port Blair. And before us, they have implemented for their helicopter-based, if the helicopter crashes and is caught fire, what do you do exactly? So the soldiers over there, the Navy respectives are trained over there using virtual reality and mixed reality, that what exactly do they have to do? How do they first extinguish the fire, and then what buttons do they have to press to shut off the helicopters, and such kind of whole other simulations. So in engineering field as well, this virtual reality has been helping many professionals a lot. And not just in educational training, we specifically have been working with medical equipment manufacturers as well. A couple of medical equipment manufacturers such as Healthium, if you know, where they develop arthroscopy tools for orthopedic surgeries. And so for their sales perspective, not for training perspective, but for the sales people to showcase that specific tool to the doctors and the other medical hospitals that they go, to show them in a very easier way and to show the patient's outcome. We made a virtual reality simulation for them, where they go and they put that on the doctor and the doctor performs, and they understand how the Healthium arthroscopy is specifically used, right? And which increases sales. And that is also another use case of the virtual reality, not just for training. So yeah, I hope I've answered the question.
Okay, thank you. So currently, So what we are trying to look over here.
Hello.
Yeah, please,
Hello.
please.
I am Dr. Tushar from SBKS Medical Institute, वडोदरा. So आपने ये वर्चुअल रियलिटी का बताया, तो हमने स्टूडेंट को कैसे असेस करा कि उसने नॉलेज गेन करा कि नहीं करा, क्योंकि अभी कॉम्पिटेंसी बेस्ड मेडिकल एजुकेशन है, तो हम उसे असेस कैसे कर रहे हैं इन तीनों पैरामीटर्स पे। और क्या ये वर्चुअल रियलिटी हमारे कम्युनिटी बेस्ड सेटिंग में अगर पेशेंट है उसके लिए भी हम क्या यूज कर सकते हैं और कैसे हम यूज कर सकते हैं? थैंक यू।
हाँ, सो सर सारे जो सिमुलेशंस होते हैं जो हम बनाते हैं या फिर कोई और कंपनी बनाती है, वो सारे अगर मान लो हमने पैरामेडिकल या फिर नर्सिंग सिमुलेशंस पकड़ लिए या फिर डेवलप किए, तो वो सारे एनएमसी रेगुलेशंस बेस्ड बनाते हैं स्पेसिफिकली। जब तक एनएमसी के रेगुलेशंस का उनको सॉर्ट ऑफ स्टैम्प मिलता नहीं है या फिर उनसे रेगुलेशंस का अप्रूवल मिलता नहीं है, दे डू नॉट गेट द अप्रूवल टू मूव अहेड विद इट। And along with that, US में just following this sort of regulations by organization, US में virtual reality based training एक सर्टिफिकेट बन चुका है अब। जब तक तुम्हारा स्टूडेंट कोई पहले सेकेंड थर्ड ईयर के बाद वर्चुअल रियलिटी का एक ट्रेनिंग का सर्टिफिकेट मिलता नहीं है, वो लाइव पेशेंट जा नहीं सकता है। अभी वो एक सिस्टम बन चुका है यूएस में। एंड आई बिलीव दैट क्रिएटिंग एंड इम्प्लीमेंटिंग इन इंडिया इटसेल्फ, कॉलेज सच एज एम्स दिल्ली भी अभी एक्सेप्ट कर रही है सच काइंड ऑफ सर्टिफिकेशन। द असेसमेंट, यस, कि हाँ एट द एंड जो फीडबैक आता रहेगा डॉक्टर से, स्टूडेंट से, कि हाँ आपका थोड़ा असेसमेंट ये थोड़ा सा मिस्टेक हो गया, ये हो गया है, या फिर आपको थोड़ा और पेशेंट का केसेस बढ़ाना पड़ेगा, वो तो ऐड होता जाएगा। दैट विल बी नो स्टॉप टू इट, राइट, एज यू आर मूविंग अहेड विद द टेक्नोलॉजी. But there will be a point where India also will have to understand कि certification is very important in virtual reality as a medical education. Does that answer your question?
Let me add something. He was talking about assessment of the student.
Right.
In virtual reality, when a student is doing a mistake, automatically there will be bip bip, or there may be at the end marking system that you have not taken these corrective steps. So that will be there automatic, and at interval of let's say 2 minutes, 5 minutes, there could be a question, then the person is going to answer. So assessment is a really very good. Objective assessment can be done, whether the person washed hand properly or not, whether they cut the properly or not. There is a very good evaluation system.
Exactly. Or it starts from washing of hands. I mean, we got a feedback.
जो मुक्तानंद बापू वाला जो डीन है ना, वो दे रहा है लेक्चर।
Okay. So it starts from washing your hands, कि आप हाथ सबसे पहले धोए हो नहीं हो. The assessment starts from there. हमने पहले बनाया था सिमुलेशन नर्सिंग के, तो उन्होंने बोला हमने हाथ धोने का डाला नहीं था, बिकॉज वर्चुअल रियलिटी में हाथ धोना ठीक है, इट्स नॉट अ प्रोसेस, आई मीन इट्स नॉट अ कंसेप्ट वेयर कि ठीक है दे अंडरस्टैंड, बट डॉक्टर्स और स्टूडेंट्स की तरफ से ऐसे फीडबैक आया कि लेट्स स्टार्ट फ्रॉम द हैंड वॉश एंड वेयरिंग द ग्लव्स। तो हमने इसमें उस पॉइंट से चालू किया कि पहले हाथ वॉश करके ग्लव्स डालेंगे, फिर वो उस इक्विपमेंट टूल सिलेक्ट करेंगे, कौन सा एग्जैक्ट टूल सिलेक्ट करेंगे कि हाँ उन्होंने अगर आईवी कैनुलेशन के लिए प्रॉपरली टूल सिलेक्ट किया नहीं किया हुआ है, उसको हम असेस करेंगे। इफ दे आर सिलेक्टिंग अ रॉन्ग टूल, देन वी विल करेक्ट देम एट द सेम स्पॉट एट द सेम टाइम, या फिर एंड में। और फिर अगर स्टेप कर रहे हैं, या फिर अगर स्टार्टिंग से स्टेरल टेप लगा लिया, या फिर कभी उन्होंने टर्नोकेट निकाला ही नहीं हाथ से, देन दैट विल बी अ मार्क कट फॉर देम। और ऐसे सिचुएशन ऐसे होंगे कि इफ दे आर डूइंग अ वेरी ह्यूज मिस्टेक, तो फिर until unless they redo it again, वो आगे नहीं बढ़ेंगे। So this kind of assessment also is done in the simulations, virtual reality में।
ओके, थैंक यू सो मच। और हम ये क्या पेशेंट के लिए कुछ यूज कर सकते हैं, जैसे योगा सिखाने के लिए, ऐसा कुछ हम इसमें कर सकते हैं?
हाँ, तो हमने योगा, यस डेफिनेटली योगा के लिए भी यूज हो सकता है। आई मीन एक्सरसाइज के लिए तो अभी आजकल बहुत यूज हो रहा है वर्चुअल रियलिटी, कि ऐसा समझ लो कि सामने से कुछ तो एक आग का गोला आ रहा है, एंड कि एक कोई एक्सरसाइज कर रहा है और वो आग का गोला बस उसको डॉज कर रहा है आके, सो दे आर हैविंग एक्सरसाइज ओवर देयर। एंड अलॉन्ग विद दैट पेशेंट्स अगर की बात जाए, तो फिर हमने ऑटिस्टिक चिल्ड्रन के लिए भी किया था सफदरजंग हॉस्पिटल के लिए, जहाँ पे ऑटिस्टिक चाइल्ड को एक एनवायरमेंट को सिखाना उसको बहुत मुश्किल होती है, इवन फॉर द डॉक्टर्स बहुत मुश्किल होता है उस बच्चे को सिखाना वगैरह। ठीक है, उनको वर्चुअल रियलिटी का हेडसेट पहनाने बहुत मुश्किल होता है, बट वंस दे वेयर द हेडसेट, वो लोग जब हाथी का आवाज सुनते हैं या फिर अलग अलग एनवायरमेंट में जाते हैं, दे आर अकस्टम टू दैट एनवायरमेंट मच फास्टर देन जो डॉक्टर उनको लाइव में सिखाता है। सो हेंस या पेशेंट के केसेस में पोस्ट ऑपरेटिव एक मदर हैज गिवन अ बर्थ टू अ चाइल्ड एंड शी इज इन अ लॉट ऑफ पेन, तो फिर उनको वर्चुअल रियलिटी पहना के एक शांत सा फॉरेस्ट एरिया में एक बर्ड चर्पिंग एंड द वाटरफॉल वगैरह वो सुना सुना के और दिखा के उनका पेन ठीक हो जाता है. सो यस, इन दिस केस ऑल्सो वर्चुअल रियलिटी हेल्प्स अ लॉट.
Good evening. This is Dr. Aniket. Hello.
Hello, yeah, please.
Regarding this hardware, so hardware is available, and regarding this courses, so do we have this courses available in this instrument only, or we need to create and purchase those VR courses or something like what we can say the software or something for this?
हाँ, सो सॉफ्टवेयर इज व्हाट वी प्रोवाइड. हार्डवेयर ठीक है, आपको ऑनलाइन में मिल जाएगा और हम भी दे सकते हैं, बट सॉफ्टवेयर इज व्हाट वी एग्जैक्टली प्रोवाइड. और हम स्पेसिफिकली मेडिकल एजुकेशन और मेडिकल इंस्टीट्यूट को जो चाहिए उस हिसाब से वो कोर्सेज बना के उनको दे देते हैं, एंड फिर उसमें ऐड करते जाते हैं कि हाँ मेडिकल इंस्टीट्यूट बोलता है हमें ये भी चाहिए, ये भी चाहिए, ये भी चाहिए वगैरह, फिर उसमें ऐड करते जाते हैं हम. सो हाँ, सॉफ्टवेयर अलग से लेना पड़ता है, उसमें ऑलरेडी इनबिल्ट नहीं रहता. इट्स लाइक योर व्हाट्सएप, आप गूगल प्ले स्टोर में जाओ, डाउनलोड करो, आपको डाउनलोड आ जाएगा. किसी दिन अपडेट आ गया या कुछ नया, आपके व्हाट्सएप का कुछ नया अपडेट आ गया, आप व्हाट्सएप को जाके अपडेट करते हो. सो इन द सेम वे आपको VR हेडसेट में पूरा वो एंड्रॉइड बेस्ड डिवाइस है, आपको जाके अपडेट करना है, आपके सारे सिमुलेशन वापस आ जाते हैं.
Thank you.
Any other question? Dr. Aniket, we are planning to have this kind of workshop, actual workshop, whereby people use it, how to use it, right? So all the 40 medical colleges, we want to get together either at Chapada, Muktan Babu Medical College, or somewhere in Ahmedabad. And I think you have a very good experience of organizing workshop and conferences. And you can think of liaising with some organization, and we can do it for the medical education.
Yes, sir. We'll try. Yes, sir.
Thank you. किसी ने बीच में when I was presenting, someone was asking a question regarding a medical, if it was regarding our simulation or they were speaking with themselves. I'm not sure who was it.
I have a doubt, Dr. Rajni. Can I ask?
Yeah, please.
Sir, what is the role of this virtual simulation in medical microbiology lab?
Medical microbiology, again, I think you called me Dr. Ashish. I'm not doctor. Thank you for the respect, but I don't deserve that. But yes, there definitely can be. As I'm not from medical background, maybe Dr. Rajesh Mehta can be able to tell you on that.
Yes, I will tell you. In microbiology, the various staining processes are done, and then bacteria and viruses, fungi, etc. are found out. So same procedure what we are doing in microbiology, or sometimes taking in pathology also taking biopsy and then examine under the microscope. In virtual reality, you will be able to see exactly what students are going to do. So what happens in this? In a microscope, when you want to show them, you need to have so many slides and 5 sets of slides. Even in, for example, in community medicine, we want to show various types of mosquitoes, etc. In the same environment can be created with a virtual reality. Only thing, virtual reality, 1 hour session creation takes 300 to 400 hours to prepare the software. Is that meticulous is required. Otherwise, whether you call it microbiology or in the community setup, for example, in community you want to demonstrate some how to prepare ORS, how to prepare or how to talk with the people, etc. So all this skill development, whatever you say skill development, whether it's a speech or with the hand or is the legs, etc., that can be done with VR. Only thing that it requires a lot of efforts to make it more and more accurate. That's why we need cooperation of for all of you in using this tool as well as giving a feedback and then assisting in creating various modules. So it is possible in microbiology also, in biochemistry also.
Thank you. Thank you for the information, sir.
Thank you, sir. Do you have an update right now for what exactly it is being used? You said staining techniques. So anything else, sir? Any skill can be developed by VR?
See, in micro, whatever you say, you do in microbiology can be done in VR.
Do you have a reference
Whether
material? Yes.
reference, they have to create there. Right now, they have not attended the microbiology. They have prepared a module for the dissection, module for the surgery, module for the
And that have come
the
across for dissection
nursing
surgery.
skills, etc. So
Right.
they will go on adding the various skills, etc.
So we have created courses for MBBS as well of anatomy, BD Chaurasia book specifically mentioned, radiology, pathology, but not for microbiology yet. Even not even for pathology yet, but radiology and yeah, please. Yeah, ma'am, you're speaking.
Excuse me.
Yeah, please tell me.
Good evening, Rajesh sir. I am Dr. Sanjeev, and good evening, everybody. I am Dr. Sanjeev calling from Jammu and Kashmir.
Great to have you, sir.
So, anything? Good evening, Dr. Rajesh sir. Good evening.
Good evening. Good evening.
Sir,
Please
hope you
carry
remember
on.
me. I just want
I
to
don't
inquire.
remember you.
Yeah. I just want to know whether there is anything in the pharmacology department also. And
Yes, I remember
what is
you.
the real difference
Sir,
between simulation and this virtual reality? Basically, in pharmacology, we have simulations like we have in anesthesia, SimMan. Nowadays, it's there. It evaluates all like oxygen saturation is low, then it gets ionized. That it's almost 70 lakhs. That SimMan. Then we have these simulations for IV injections and IM injections. Everything is there. So, what is the exact difference between this virtual reality and this simulations? So what can we do in pharmacology?
So in pharmacology, so say for example, in models, if you give the injection, the blood pressure is increasing, right?
Yeah.
In models
Yeah.
simulation. In that, the thing is, we don't say that models are not correct or etc. etc. It's a bit a costly affair. So in
Yeah, but
virtual reality, we can do that simulation and with a very, very low cost.
yeah.
Initial cost of preparing manufacturing is difficult. Say, for example, you are giving anesthesia, patient responding in a particular way.
Mhm.
So in models, sometimes after 1,000 uses or like that, models will get disturbed. You
Yeah.
will not be able to repeatedly use that in that simulation process. But in virtual reality, even if you use lakhs of times, there
Mhm.
won't be any disruption, etc.
Yeah.
So
But
if
sir,
you look at the
sorry to interrupt you, but we have this
yeah.
X-Pharma, this software. I hope maybe some microbiology or physiology people know X-Pharma, which is indigenously made by Dr. Ravindran from Pondicherry, Jipmer Pondicherry. So we like, for example, we inject the drug into mice or rat. Then if we see the dilatation or this constriction of the pupil. So we already have that in our computers. We are doing that in our medical colleges. That is called as computer-assisted lab. That MCA is also mandatory for every pharmacology department to have that computer-assisted lab. So what will be the real difference between virtual reality and that? Because that softwares are available and we inject the medicine on dog experiment, on rabbit experiments, histamine, guinea pig, helium. We all are doing that. So what is the exact difference? I am not
So
able to.
when you give an injection in a
Yeah.
computer assisted lab, do you have that feeling of giving injection?
No. That feeling is not there. No, it's just
So that is
theoretical.
so what I say that in computer assistant, what you are doing experiment just to show to the people that this effect will be because of this.
Yes,
But
sir.
in
Yes.
virtual reality, you are actually getting a feel that you are giving
Oh,
injections.
okay.
Is
That's
basically is a combination of skill development as well as knowledge development. It's combination. While in
that's nice.
simulation, only knowledge based.
That's
Dr. Sanjeev Gupta, I remember you are a great person of your superintendent post and all those things.
No,
So
I am associate professor in the Department of
assistant
Pharmacology.
professor.
Associate
Okay,
professor.
As I don't remember then.
I
then
talked to
so-
you that the next year I will be eligible for professor in next year in
Acha,
February.
acha. Okay. I
Yeah.
forgot that. So I recruit took a lot of the interviews of I think more than 500 people.
Yeah. So I
Sorry.
talked to you twice or thrice. So I told you next year.
But in virtual medical college we'll meet together many times. Yeah.
Hope to meet you, sir. I will be lucky. Feel
Yeah.
lucky that if I'll be able to join.
You could
Let's
be
hope for the
you
best.
could be next speaker. Yeah. So
Let's
anyone
hope for the
else?
best. Thank you, sir.
Yeah.
Thank you.
Anyone else would like to introduce themselves, ask some question? If you want to purchase this software, or if you want to want to have a demonstration at your place, all this thing is possible.
And any special training, sir, who can train? For example, if I want to get trained so that I can train other people also in this course.
So for that, we are going to have two kinds of courses. One is a 3 months course, online course, only for the purpose of how to use it, etc.
Okay.
But then in a workshop, we'll have actual feel of it, how to you are going to train the students. So 3 months basic course will be just to create awareness one by one module across the nation. That is a 3 months module. Very token price will be there. But for the training workshop, for example, in Jammu Kashmir, around 40-50 participants are there. Ashish will visit definitely Jammu Kashmir and give a training in that workshop.
But
so
for example,
right now we are planning.
That will be for how many days?
That
will be for how many days?
Other
One day
college in Gujarat or Maharashtra.
Someone is speaking. So it will be a one-day workshop initially, and then once the medical college feels that they want to purchase this software, in that case they will be frequently training the people. In Gujarat, we are going to train one person who will go to all the 40 medical colleges and train others like that. So because based on the procedure, once you have one day exposure in the workshop, then you are not going to do anything else. So it's a self-learning module. It's only one day's training will be sufficient initially, as far as the workshop is concerned, right?
Yeah. So one more thing, sir, just if you don't mind, that simulation which I told you in pharmacology, X-Pharma, they are softwares. But the mannequins we also have for intramuscular, intravenous injections. Then I told you one is very costly. That costs 70 lakhs, SimMan.
Yeah.
That mannequin is around 70 to 80 lakhs. That, for example, if the oxygen saturation falls below something, it gets cyanosed and all that. So there we have a field. In mannequins also, when we give intravenous injection or intravenous or intra-arterial, then we have the fields. So they again mannequins and they can replace by a virtual reality, I hope.
Yes, definitely.
Okay.
Definitely possible.
Okay, sir. Okay. Thank you, sir. Thank you.
Thank you.
So Ashish, any last few words?
So yeah, I mean, so we are trying to collaborate. I think I read someone in the group as well who has some ideas, want to collaborate in this medical domain for the virtual reality. We'll be happy to have such kind of bright minds and work with them, and along with that, explore how the virtual reality more can be able to help medical students or in their own medical colleges, right? So we'll be happy to work with them and vice versa. Right. So yeah, that will be my concluding talk to it. I hope you all have a great day.
Yeah. So the Dr. Narendra Waghela, although he is not speaking, but he is a master gynecologist. He can be helpful in conducting normal delivery, in doing a cesarean section, etc. How exactly it should be done. So if your team is ready to collaborate with Narendra, he is at the Surat, right? So we have more than 18,000 students across the world I have trained, and few gems. One of them is Narendra. Narendra, can you help in future? Narendra is silent. Anyway, so
I would like to, if there is any possibility of doing that, I would love to do that if there is any possibility.
Definitely.
Because I have not only experience in pharmacology, I have the working in the peripheral hospitals for almost more than 20 years. cumulative experience. So in emergencies also we can do that in medical teaching in different domains. We can make the tutorials, we can do many things collaboratively.
Sure, definitely.
So, Narendra, can you spell out few words? Dr. Narendra Waghela. Hello. Anyway, we will conclude our session over here. And now in our group, those who have attended should write. I will just write down in the chat our number, in which if you send your request, if you send request to this number, you will get ebook. And my number also I am saying 9428503295. These two numbers are shared over here. And if you send over here, you will get an ebook, which is very well written by Ashish. And then also we are preparing for online 3 months the course, a certificate course, and then actual workshop in Gujarat, Jammu, Kashmir, wherever people call us. At least we need 40 to 50 doctors to attend from various medical colleges. And
Okay.
then if someone wants to purchase it in a collaboration cooperative way or an individual, they can also connect us.
Okay. Sir, can you please repeat the numbers?
9428503295.
Okay. Yes. Okay, sir. And the second one?
99099.
This is your number, sir?
No, 68495.
99099?
Previous one was my number.
99099?
68495.
Okay, sir. Okay. Thank you
Previous
so
one
much.
was mine. The second is our office number, Human Health Circle.
Okay, sir. Thank you, sir. Thank you.
Yeah. Okay.
Thank you, sir.
I think Dr. Rajesh Mehta got cut off. But yes, that will be the concluding to it. And as sir have said, we'll be sharing the ebooks to every one of them. So it was great having this Q&As and this session with every one of you. Thank you, everyone.